It's a club no country wants to be part of, but Friday saw India join the US and Brazil in passing 1 million cases of coronavirus. India's population is around 1.3 billion, so experts are saying 1 million is still relatively low, but infections are spreading further into the countryside and smaller towns, putting further strain on healthcare systems.
What I see is that as the number were much more in the previous months, now the number of indoor hospitalized patients is decreasing in Delhi, but in the other part of the country, the number is increasing.
Efforts to contain the virus have seen authorities impose fresh lockdowns and designated new containment zones, but some areas have struggled to keep people indoors.
I think if you look at the on the road, there are many people outside, and at this rate, I don't think it's going to go down. So what I feel is we should take as many precautions as we should. Use sanitizers, carry masks. I see so many people without masks, and I'm like, why don't they want to wear any mask?
Epidemiologists say India is still likely months from hitting its peak, whilst public health officials say they now need to work on lowering the mortality rate. One official said a critical challenge now is how to appropriately allocate hospital beds.
We have prepared. We have the enough number of ICU beds. We have enough number of semi ICUs and HDU beds. We have enough number of oxygen beds. So we can manage even if we have the larger number and secondary waves comes. Then we have very excellent facility, very good facility, and we are prepared for that.
Last week, India overtook Russia as the world's third most infected COVID-19 country. The official number of cases in the country on Friday was listed as 1,003,832, but experts have called that a, quote, gross underestimate and has likely left out many people who may have been asymptomatic. That compares with 3.6 million confirmed cases in the United States and 2 million in Brazil, countries with less than a third of India's population.